This is why you need to pay attention to your urine color. It could reveal more about your health than you think. Normal urine color ranges from pale yellow to deep amber, mostly depending on how much water you've had. But did you know certain health issues can change that color dramatically? Hepatitis, a liver inflammation, can turn your urine dark like tea or cola. This happens because your liver can't process bilirubin properly. Other signs include fatigue, nausea, and yellowing skin or eyes. On the flip side, kidney stones can make your urine turn pink, red, or brown due to blood. They come with severe pain in the side or back, nausea, and frequent urination. If you notice significant changes in urine color along with pain or fatigue, see a healthcare professional ASAP. Early diagnosis is key to managing both conditions. Stay hydrated, eat a balanced diet, limit alcohol and caffeine, and exercise regularly to keep your liver and kidneys in top shape. Remember, urine color is just one clue. Always get a comprehensive checkup for accurate diagnosis and treatment. Curious about more health tips? Subscribe and stay informed.